Hello everyone, welcome to another video. In this video we'll be discussing on another very important topic known as simple partial seizures. So what is a seizure? A seizure is basically a sudden uncontrolled electrical disturbance in the brain, and it can cause changes in behavior, changes in movement, and like the person's level of consciousness. So depending on which part of the brain is affected. So looking at simple partial seizures is a type of seizure that it starts in one specific area of the brain. So it has a focal onset, and then it does not affect consciousness or awareness of the person, and it may cause unusual sensations, muscle movements like twitching, or emotional changes depending on the brain region that is involved. So the person most of the time is fully aware of what is happening during when they're having the seizure. So looking at the anatomy, the brain has different lobes which are specific for different functions. Like each lobe has a specific function. So we have the frontal lobe, which is responsible for movement, behavior, and reasoning. Then we have the parietal lobe, which is responsible for touch sensation, pain, spatial awareness. Then we have the temporal lobe, which is responsible for hearing, memory, and emotions. Then we also have the occipital lobe that is responsible for vision. So when a seizure begins in a specific lobe, the symptoms will reflect the function of that particular lobe. So if we have a seizure happening, we'll talk further on the symptoms, but I'm just giving an example. If we have a seizure happening in the frontal lobe, you see symptoms like twitching, because it's more involved. It's like movement and like behavior. So when it comes to simple partial seizures, the abnormal electrical activity is limited to one region, so it does not cause like loss of consciousness. So looking at the pathophysiology of simple partial seizures, so seizures result from sudden excessive electrical discharges in brain cells known as the neurons. So in simple partial seizures, these discharges are localized, affecting only one part of the brain, and this usually leads to specific predictable symptoms depending on the area involved. So what exactly causes this partial simple seizures? So for example, we have presence of brain injury or brain trauma, then stroke, having brain tumor, or some brain infections like meningitis or encephalitis can cause this simple partial seizures. Then also congenital brain malformations, genetic epilepsy syndromes, and then having scar tissues from like past brain damage. And sometimes there's usually no clear cause of this seizure, so it can be idiopathic. So looking at the signs and symptoms, so like I said before, the symptoms vary based on the location of the seizure in the brain. So if the area affected is the motor area, that is the frontal lobe, there will be signs of twitching of the face or the limbs, and like the person will have like this kind of repetitive movements. Then if it's in the sensory area like the parietal lobe, there will be tingling, there will be burning, and there will be numbness, because they are involved with like the touch and all those things. Then if it's in the occipital lobe, there will be visual disturbances like flashing lights. Person will be seeing flashing lights. And with the temporal lobe, there will be like presence of odd smells or tastes, and like having a feeling of deja vu, and having like this intense emotions. Then if it's in the autonomic area, there will be nausea, sweating, and like rapid heartbeats. So the person's awareness is fully preserved, so the patient often remembers the seizure and can describe the event, like what exactly happened during the seizure. So looking at the differential diagnosis, so to rule out other conditions that look similar, like for example, the migraine aura can look similar to these simple partial seizures. Then sometimes panic attacks to and also when a person has tics or movement disorders, like there will be repetitive movement that is also seen in this particular kind of seizures. Then also when somebody has a transient ischemic attack, and also when somebody has psychogenic non-epileptic seizures too. So how is it diagnosed? So it's diagnosed by taking a detailed history, like we try to ask the patient like questions like what the patient felt, how long the seizures lasted, and if there was any trigger before it started. Then we also do an EEG and electroencephalogram, which detects the abnormal brain wave activity. Then we can also do MRI and CT scans to check for structural issues, like if there's brain tumor or if there's scarring, and then blood tests to rule out like metabolic or infectious causes. So looking at the treatment, we use anti-epileptic medications for simple partial seizures, like for example carbamazepine, which is very effective for focal seizures. So seizures are in the motor area, is very effective. Then lamotrigine, which is good for long-term use and has like fewer side effects. Then levetiracetam, which also has like fewer drug interactions. And also oscarbazepine can be used too. It's similar to carbamazepine, but it has better side effect profile. Then we can also use phenytoin. Phenytoin is actually an older drug, so it usually requires more monitoring, like when it is used. So the medication is usually continued for years until like the seizure control is stable. That is like for 2 to 5 years seizure free. So for the management strategies in this case, we have to tell the patient to avoid the seizure triggers, like if it's stress, if it's sleep deprivation, if it's alcohol, if it's when they take a particular kind of thing. So avoid seizure triggers. Then medication adherence is very crucial. So because skipping doses can increase the risk of this seizure coming back. And also some lifestyle changes, like getting enough rest, avoiding like driving or other kind of daily activities until advised that is safe by the neurologist. Then also checking your diet too, like having a ketogenic diet, which might help in resistant cases. So basically this simple partial seizures is like when you have a type of seizure where only a small part of your brain becomes overactive. So this can cause your hand or face to twitch or make you feel strange, but you are still fully aware of yourself during the episodes. So usually with the right medication, it can be controlled and you can basically live a normal life. So it's not a death sentence. Sorry, it's not like something that's like it's the end. It's not like when you have it seems like the end of the world. It can be controlled and you can actually live a normal life. So in summary, when it comes to this kind of seizures, the consciousness is usually preserved. The person is fully aware that they're having the seizure, and then usually the duration is usually seconds to like 2 minutes, and then the symptoms are based on the location of the brain where the seizure is happening. Like it's localized, if it's the motor area, the sensory area, so they all have different symptoms. Then diagnosis, EEG, brain imaging, getting the patient's history, then treatment using anti-epileptics like carbamazepine, lamotrigine. And this particular kind of seizure, it has gotten a new name actually. So it's either called simple partial seizures or it's called focal aware seizure. So that is basically it for this topic, and I hope to see you in the next video. Thank you. Bye.